this here is a surgical drain. How this works is, this is what the drain inside your body looks like. It's like a gummy worm. And we put this in areas where the fluid needs to be evacuated in order for your body to heal internally. So how this works is this drain, this end, like a gummy worm, sits in the area of your body that we need to drain to help prevent seromas and improve internal healing. And that fluid gets collected in this little reservoir. So how this works is the fluid will get sucked into here, and there's a valve. So when you empty it, what you do is you screw off this top. The top gets screwed off like this, and you squirt it into a little measuring cup that we give you. And then you write down the date, the time, and how much fluid you emptied from the bulb. Once it's out, you squeeze it back together like this, put the top back on, and now, well, it's not gonna hold suction because it's not in anybody's body. But what happens then is it will stay collapsed. So if I do this and kink the tube, so it'll actually hold suction. So here we go. So I'm kinking the tube and it's holding suction now. So what happens is slowly over time, under suction, that fluid, in this case air, is gonna be sucked up into that bulb. And when it gets about half full, you need to empty it again and put it back to suction. Because once it is over half full, it really doesn't have much suction anymore, and the fluid's gonna start to build up inside your body. A common problem that happens when people have drains is that fluid will start leaking around the drain, meaning where the drain enters your body, fluid leaks around the drain, sort of where your drain meets your skin. And the most common cause of that is that the drain is clotted. So the drain tube, somewhere along the tube, there's a clot. So to fix that, what you do is you go to where the drain enters your body. Say that right here is where the drain enters your body, like right there. Then with one hand, you hold it against your body because you don't want to pull it out of your body. And then you strip it like this. And you'll get a little ways, and then you change your grip, hold it there, strip that way, hold it there, strip that way. You're basically milking any clots into the bulb. And then the drain should function appropriately again, and the fluid will make it to the bulb, which is where we want it to go. But as always, if you have any questions or concerns, do not hesitate to call us or shoot us an email. You can call us at 850-500-7527. You can also send us an email to info@restoreplasticsurgery.com. One other point to add about drain care is that we generally take drains out once they are producing less than 30 cc's in 24 hours. So over a 24-hour period, we want those drains making less than 30 cc's. Now, if you have two drains that are in the same place, such as two drains underneath the skin of a tummy tuck, we never like to take out both drains on the same day. Because once we take out one drain, the other drain is gonna make more fluid because it is doing all the work. So generally we'll take out any drains once they're making less than 30 cc's in 24 hours, but we never take out two drains from the same location on the same day. Another common question people have about drains is, what do I do when I shower? So the best advice I can give you is to just let it dangle. So if this is where it sort of leaves your body, where my fingers are here, just let it dangle and take a shower. It can get wet, you can get soapy water on it. In my opinion, it is better to keep your body and skin clean than it is to seal everything up. If you put a bunch of dressings around where the drain enters your body for much longer than 48 hours after surgery, I find that the amount of bacteria living in those dressings is worse than if it were exposed to air. So after 48 hours, we want most of those dressings off so that they're not trapping bacteria where your drain enters your body. But we will give you specifics on what to do depending on the procedure you had. So please refer to those specific procedure videos. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.